Good afternoon, everybody, and welcome to Medicare Basics, presented by Hoag Hospital and the Hoag Medical Group and the Hoag Physician Partners. The Hoag Medical Group and Hoag Physician Partners are an excellent team of doctors that provide internal medicine, family practitioners, and they have a list of over 350 specialists. And my name is Derek Tarvin, and I've had the honor and privilege of working with Hoag Hospital as their outside insurance consultant for over 25 years. We have a family business and we have an office in Costa Mesa. We counsel everybody on Medicare, Medicare options, and we can help review any individual or group plan that you have and compare that to your Medicare options. And today, we're going over what is Medicare, signing up for Medicare, the two main choices for Medicare plan coverage, which can be a Medicare Advantage HMO or Medicare Advantage PPO. We'll discuss the Medicare supplements, also known as Medigap. We'll be talking about the Medicare Part D prescription drug plans, extra help, and various enrollment timeframes. So what is Medicare? Medicare is health insurance for persons that are age 65 or older, or any of those that are under age 65 and have received disability benefits for 24 months. Also, those that have end-stage renal disease or Lou Gehrig's disease also qualify for Medicare. Medicare has four different parts. Part A, which is your inpatient services. Part B, which is where all your medical services fall under. Part C is considered the Medicare Advantage HMO or Medicare Advantage PPO. And then Part D is considered the prescription drug coverage. Only Medicare Parts A and Part B will appear on your red, white, and blue Medicare card. And there's a copy on your screen that you'll receive once you enroll. Medicare Part A, this is where your inpatient hospital services and inpatient services fall under. Most people do not pay a premium for Part A of Medicare. It was paid by you or your spouse through payroll taxes while working. It helps cover inpatient services in hospitals, skilled level of nursing care in nursing facilities, hospice, and very limited part-time medically necessary home health care. Part B of Medicare, this is what all your medical services and outpatient care falls under. Whether you're inpatient in a hospital, skilled nursing, or outpatient services, always fall under Part B of Medicare. Most people do pay a premium for Part B of Medicare. The standard premium for Part B of Medicare this year is $148.50 per month, but it can be more than that depending on your income. The premium for Part B of Medicare is deducted from your Social Security benefits if you're drawing Social Security. Otherwise, you'll receive a quarterly statement in the mail until if and when you start drawing Social Security, and at that point, they'll automatically deduct it monthly. Part B of Medicare, that helps cover your medically necessary doctor services, outpatient care, tests, medical equipment, limited home health care, preventive services, and much other services. Unfortunately, those that are higher Medicare income beneficiaries, you will pay more for your Part B of Medicare. The way that Social Security determines what your Medicare premiums are is they look at your tax return at your modified adjusted gross income. And they always look back 2 years at your modified adjusted gross on your tax return. So for the year 21, they look at your 19 tax return and modified adjusted gross. And on your screen, those that are individual filers that your modified adjusted gross in 19 was less than $88,000, or those that file a joint tax return and your income was higher than $176, they will increase your Medicare premiums based on what they call an income-related monthly adjustment amount, or IRMA. And the different levels that you can pay are on the screen, and it can go as high as this and what you see on the bottom. And let me go back a screen. So Medicare or Social Security will audit your income every year, and your Medicare premiums can go up or down based upon your filings. And obviously those that are working 2 years previously, and if you go on Medicare, your income has gone dramatically down than 2 years previously, you can actually appeal to Social Security and discuss your current financial status with them, and they may lower your Medicare premiums based on your current financial status. Otherwise, they will audit it every year, and your Medicare premiums will automatically be adjusted higher or lower based upon your income from 2 years previously. But if your income has gone down 2 years ago, then when you qualify for Medicare, give Social Security a call and discuss your current status with them, and they may lower your premiums based on your current financial status. So signing up for Medicare. Medicare usually starts on the first day of the month that you turn age 65. Unless your birthday falls on the 1st, then they actually backdate it a month. Otherwise, you're eligible for Medicare on the first day of the month that you turn 65. If you're receiving Social Security or railroad retirement benefits, you'll actually automatically get enrolled into Medicare, and you should receive a Medicare card 3 months before you turn 65, or the 25th month of receiving disability benefits. If you're in these situations and you do not receive your Medicare card automatically, give Social Security a call, and their number's on the screen. They are open Monday through Friday, and the time on the screen is a little off. Actually, they're open Monday through Friday from 8 to 5, and if you want to give the local Social Security office a call, it's usually a little quicker than giving the main number a call. And typically, the local Social Security's office are open 9 to 4, Monday through Friday. If you're not receiving Social Security or railroad retirement benefits, you actually must sign up for Medicare through Social Security to get your Medicare card. And there's a few different ways you can do that. You can call the Social Security office, the main number, or your local Social Security office. Or you can go online if you prefer not to call. And if you go to ssa.gov, ssa.gov, on their home screen, in the middle page to the right, it says Medicare enrollment, and you click on that, and then scroll down on the next screen to where it says Medicare enrollment, and just click on that, and just follow steps. It's a pretty straightforward process. It takes about 10 or 15 minutes. If you have any issues or problems, give Social Security a call, and they're usually very helpful, very friendly, and very knowledgeable. They're one of the better government agencies actually to deal with. So there is an initial enrollment period for signing up for Medicare. You may sign up for Medicare 3 months before the month you turn age 65, during your birthday month, and up to 3 months after your birthday month. If you sign up for Medicare 3 months before your birthday month, Medicare will start on the first day of the month that you turn 65. If you sign up during your birthday month or within 3 months after your birthday month, Medicare will start 1 to 3 months after signing up. There is a general enrollment period for signing up for Medicare if you miss your initial enrollment period. And this occurs every January 1st through March 31st. And the coverage will start on July 1st, and you may incur a late enrollment penalty. There are other situations for signing up for Medicare. Those that are covered by employer-sponsored group health plans, and current employment is based on more than 20 employees, you can actually delay signing up for Medicare Parts A and or B with no penalty. However, when employment ends or group coverage ends, whichever happens first, you have 8 months to sign up for Medicare Parts A and Parts B with no penalty. So if you're working covered under group insurance and there's more than 20 employees, you can actually delay signing up for Medicare Parts A and or Part B with no penalty. And then whenever employment ends or group insurance ends, whichever happens first, then you have an 8-month window to enroll into Medicare Parts A and or Part B with no penalty. And always check with your group health plan, benefits advisor, or human resource to see how Medicare works with your group insurance. Those that are covered by employer-sponsored group health plans and have Part A only, you can delay signing up for Part B of Medicare with no penalty. And again, this is based on current employment and covered under the group insurance, and there's more than 20 employees. Again, once employment ends or group insurance ends, whichever happens first, you've got 8 months to sign up for Part B of Medicare with no penalty. And let me back up a slide. So typically the rule of thumb is if you're currently working covered under group insurance and there's more than 20 employees, you can sign up, delay signing up for Medicare Parts A and or Part B with no penalty. Typically, if there's less than 20 employees, you're still working covered under group insurance, usually Medicare becomes primary at that point. So if you're working covered under group insurance, there's less than 20 employees, typically you're going to want to sign up for Medicare Part A and Part B because at that point, Medicare becomes primary. There's exceptions to every rule, so always check with your human resource or benefits advisor to see how Medicare coordinates with your group insurance. But again, the typical rule of thumb is if there's more than 20 employees, you're covered under group insurance, still working, you can delay Medicare Parts A and or Part B with no penalty. If there's less than 20 employees, you're covered under group insurance, still working, typically you're going to want to sign up for Medicare A and B because at that point it becomes primary. So oftentimes those that are still working covered under group insurance and there's more than 20 employees, you can go ahead and sign up for Part A of Medicare because typically there's no premium for Part A of Medicare and it's not going to correlate with your group insurance, so it's really a formality. So if there's more than 20 employees covered under group insurance, typically you can go ahead and sign up for Part A and then delay Part B of Medicare because you don't want to pay for Part B of Medicare without needing to. So if you have Part A of Medicare and delay Part B, and in the future want to sign up for Part B of Medicare, there's 2 forms that will need to be completed. We have those forms in our office, or you can get those online through Social Security. And if you have Part A and then you need to sign up for Part B of Medicare in the future, there's 2 forms that need to be filled out. One you'll fill out, and then one you and your employer fill out. And you submit those 2 forms to Social Security, and they enroll you into Part B when such time is necessary. So those that have a health savings account contribution by your employer and you're still working, there's more than 20 employees, typically you're going to delay signing up for Parts A and or Part B because if you have a health savings account contribution by your employer and you're eligible for Medicare, signing up for Part A can have an effect on your health savings account. So if there's more than 20 employees and you have a health savings account contribution by your employer, always check with your human resource or benefits advisor to see how signing up for Medicare while you're still working can affect your health savings account. But if there's no health savings account contribution by your employer, you're eligible for Medicare, go ahead and sign up for Part A because there's no effect on your health, your group health insurance. It's just if you have a health savings account contribution by your employer, you're eligible for Medicare, still working, I'd most likely delay Parts A and or Part B until either the group insurance terminates or the employment terminates. So those that are covered by COBRA, this is kind of a tricky one. COBRA is a continuation of your group insurance once employment terminates. And typically, you're eligible to stay on COBRA for a period of 18 months, sometimes up to a period of 36 months on special occasions. And COBRA is a continuation of group insurance once employment is terminated. So if you're going to stay on COBRA and you're eligible for Medicare, make sure you sign up for Medicare within 8 months of your employment terminating, even though you can stay on COBRA for a period of 18 months or 36 months, because employment is terminated, and it's one of those 2 criteria, employment is terminated or group insurance terminated, and you don't want to get penalized for enrolling into Medicare late. So if you're eligible for COBRA, and you're staying on the COBRA and you're eligible for Medicare, go ahead and enroll into Medicare if you're going to stay on COBRA because you don't want to get penalized for enrolling late. And COBRA can be very expensive if there's no contribution by the employer once your employment is terminated. So it's always a good idea to review what the premiums are for COBRA are and compare that to individual options for Medicare and enrolling into Medicare because it may be cheaper than staying on the COBRA. But if you're going to stay on COBRA and are eligible for Medicare, make sure you enroll into Medicare within 8 months of your employment ending so you don't get a late enrollment penalty. Those that are covered by VA insurance, and we get a lot of questions on that, you do need to sign up for Medicare A and B, even if you stay on the VA and don't enroll into an individual Medicare plan that goes along with your Medicare. So if you're eligible for Medicare and you have VA coverage, make sure you enroll into Medicare during your initial enrollment period. 3 months before you turn 65, the month of that you turn 65, or 3 months after. Because if you have VA coverage and are eligible for Medicare and don't enroll, unfortunately, they will accrue a penalty. So if you're eligible for VA, make sure you sign up for Medicare A and B so you don't get penalized when you're first eligible. So now we're going to talk about the two main plan choices for Medicare plan coverage that goes along with your Medicare Parts A and Part B. We'll be discussing one option, which is the Medicare Advantage plans, and it can be a Medicare Advantage HMO or Medicare Advantage PPO. With the Medicare Advantage HMOs here in Orange County, most people do not pay a premium, or there's a very low premium. And the Medicare Advantage PPOs have a pretty sizable premiums as opposed to the Medicare Advantage HMOs in Orange County. Here in Orange County, most of the Advantage plans, the HMO or the Medicare Advantage PPO, do have the Part D drug coverage included into the benefits, so you don't need a separate policy. The other type of coverage we'll be discussing to go along with the original Medicare is considered the Medicare Supplement or Medigap plans. Most do pay a premium for the Medicare Supplements or Medigap plans. And the Part D drug coverage with the Medicare Supplements is not included, so you need a separate policy. To be enrolled into either a Medicare Advantage HMO or Medicare Advantage PPO or a Medicare Supplement, you must be enrolled into Part A and Part B and paying your Part B premiums. So with the Medicare Advantage HMO or PPO plans, they are also designated by Medicare as Part C, as in Charlie. The Medicare Advantage plans combined Medicare Parts A and Part B and the Medicare Part D drug coverage into one plan. The plans do include extra coverage like vision, hearing, and dental. The Medicare Advantage HMO or PPO plans, each Medicare Advantage plan has different costs, co-payments, co-insurance, or what they call yearly out-of-pocket maximums that you pay before they cover you 100%. And the drug coverage is included with most of the Advantage plans here in Orange County. Prior authorization is required for certain procedures. The plans do cover you worldwide for emergencies and urgent needed services. And the benefits for the Advantage plans can change each calendar year. So with the Medicare Advantage HMO plans, you must get your care from the plan's network of providers and hospitals, except for emergencies or urgent care situations. With the Medicare Advantage HMO plans, you must get your care again, from the plan's network providers and hospitals. So with the Advantage HMO plans, you actually select a hospital, a medical group, and primary care physician from the plan's network providers in your service area. And referrals are required to see specialists. So for Hoag Hospital, if you select your care from the Hoag Medical Group or from the Hoag, physician partners, that way you'll receive all your care through the Hoag Medical Group, physicians, Hoag physician partners, and specialists, and also through the Hoag facilities and hospitals. So again, with the Medicare Advantage HMOs, you select a hospital, a medical group, and primary care physician from the plan's network of providers. So with the Advantage HMOs, the insurance companies, like the umbrellas, they provide the medical benefits. And then there's many, many different medical groups that contract with the Advantage companies. And depending on what medical group you choose your primary doctor from, again, dictates what doctors and hospitals and facilities you have access to. So to make sure you receive all your care through the Hoag Medical Group, Hoag Physician Partners, and Hoag Specialists, and be able to access the Hoag facilities, you'd want to choose your primary doctor from the Hoag Medical Group or the Hoag Physician Partners. With the Advantage HMOs, referrals are required to see specialists, and you're not locked into a particular primary care physician or medical group throughout the year. With the Advantage HMOs, you can actually change your physicians or medical groups throughout the year. And if you do need a new physician or medical group, typically with the Advantage companies, if you change your doctor by the middle of the month, the new physician or medical group is effective at the end of the month, the following month. If it's between the 16th to the end of the month, typically the new doctor or medical group becomes effective the month after that. So again, if you want to make sure you receive all your care through Hoag Physicians, and Hoag facilities, you'd want to choose your physician through the Hoag Physician Directory for the Hoag Medical Group and the Hoag Physician Partners. And with the Medicare Advantage plans here in Orange County, most of them have a zero premium or a very low premium. And you are enrolled in a Medicare Part A and Part B and paying your Part B premiums. And then you will have co-payments or co-insurance. Mostly there's zero co-payments for most services for authorized services received from in-network providers or from out-of-network providers when approved. If you have a Medicare Advantage HMO and you self-refer out of the network or it's a non-authorized services, unfortunately, you'll pay the full cost of the services except for emergencies or urgent care. So with a Medicare Advantage HMO, make sure you go through a primary doctor to see a specialist. And with the Part D drug coverage, is included with most of the plans, so you don't need a separate policy. There are Medicare Advantage PPO plans as opposed to a Medicare Advantage HMO. With the Medicare Advantage PPO plans, you will use in-network plan providers, and you can self-refer out of the network for providers that agree to accept the plan. And with the Medicare Advantage PPO plans, referrals are not required to see specialists. You will pay a monthly premium for the PPO plan on top of what you pay for your Part B of Medicare. And then you'll have certain deductibles, co-payments, and co-insurance and out-of-pocket maximums that you pay in-network before they cover you 100%. And then typically you can self-refer out of the network and usually have higher deductibles, higher co-payments, and higher out-of-pocket maximums that you pay before they cover you 100%. And the Part D drug coverage is included with the Medicare Advantage PPOs, so you don't need a separate policy. With the Advantage HMOs, typically there's no premium here in Orange County. With the Medicare Advantage PPOs, typically there's usually a sizable premium, and you can self-refer to specialists in network or out of network for providers that agree to accept the plan. So the other type of medical insurance that you're eligible for to go along with the original Medicare is considered the Medicare Supplement, or also known as the Medigap plans. The Medicare Supplement and Medigap plans supplement original Medicare and pay secondary to your Medicare A and B. With the Medicare Supplement or Medigap plans, you can choose any doctor, any specialist or hospital facility nationwide that will take Medicare patients. Referrals are not required to see specialists, and authorizations and approvals are not required. And the Medicare Supplement plans, they have 10 standardized plans that are sold by various insurance companies. And with the Medicare Supplements, different companies will charge different premiums for the same standardized Medicare Supplement plans. So with the supplements, you do have your Medicare A and Part B, paying your Part B premiums, and then you will pay a premium for the Medicare supplements depending on what plan you choose, what company, what area you live in, and your age. The Part D drug coverage is not included with a Medicare supplement plan, so you actually must purchase a standalone Part D drug plan. So with the supplements, there's really 3 premiums involved. You have your Medicare Part A and enrolled in Part B of Medicare, and then you'll pay your Part B of Medicare premiums. You'll have a premium for the various Medicare supplement plan that you choose, and then you'd have a third premium for your Part D drug plan. And with the Medicare supplement plans, anybody who's new to Medicare as of January of Part A, as of January 2020, is not eligible for what they consider Plan F. Plan F has been the highest coverage eligible for Medicare recipients, and anybody who's new to Medicare A as of January 2020 is not eligible for Plan F, but you are eligible for Plan G as in George, which is almost identical to Plan F. It just has a minor deductible that you pay. With Plan F, there's no deductibles or co-payments, it's full coverage, and with Plan G, there's a minor deductible. So don't fret that if you're not eligible for Plan F. Plan G is very close in benefits. And with the Medicare Supplements and Medigap plans, they're what they call guaranteed renewal for life. The policies can never be canceled, and the benefits can never be changed. It's just except if you don't pay your premiums, they can cancel your Medicare supplement. Other than that, they can never cancel it or change the benefits. It's just unfortunately the premiums do go up with attained age. So now we're going to discuss the Medicare Part D, which is considered the prescription drug coverage. Medicare Part D drug coverage is available to anyone that has Medicare Parts A and or Part B. Medicare itself does not sell the Part D drug plans. To get Medicare Part D drug coverage, you actually must enroll into a plan. And there's two ways you can get your Part D prescription drug coverage. One is to buy a standalone Part D prescription drug coverage that goes along with your Medicare supplement, or enroll into a Medicare Advantage HMO or PPO that has the drug coverage incorporated into the benefits. And each Medicare Part D drug plan has a different list of drugs that it calls a formulary. And the plans will place the drugs into different formulary tiers. Usually they have 1 through 6 tiers or 1 through 5. Each tier that they place the drugs on, different formularies, will have different co-payments and co-insurance amounts that you pay. With the standalone Part D drug plans that go along with the Medicare supplement, there's 32 different drug plans you can choose from. They all have the same different coverage model that we'll go over in the slides coming up. So whether you enroll into a standalone Part D drug plan that goes along with the Medicare supplement, or those that are connected with a Medicare Advantage plan, they will have formulary tiers that they place your drugs under. And how we make our recommendations for the drug plans is based upon one's current medications, because all the drug plans that are standalone that go along with the Medicare supplement, or those that are connected with an Advantage plan, all have different formularies, and they all don't include the same medications or co-payments. So again, how we make a recommendation for a drug plan is we can input one's medications, and we get a line-by-line itemization of all 32 drug plans, and it'll list them from which plan is least out of pocket annually to which is highest. And we can do that for the Medicare supplement plans that have a standalone Part D drug plan, or those that have the Advantage plans. And we can't stress enough to analyze your Part D drugs, because it really can vary from plan to plan. So all the Part D drug coverage, whether they're a standalone drug plan that goes along with a Medicare supplement, or those that are connected with an Advantage plan, have 4 different stages. Stage 1 is considered a deductible. Not all plans have a deductible. If they do, this year the deductible can be as high as $445. So if your plan has a deductible, typically you pay the deductible, and then you're in what's called Stage 2, also known as the initial coverage stage. And typically in the initial coverage stage, you're going to pay those co-payments or co-insurance from tiers 1 through 6, depending how your drugs fall on that particular plan's formulary. And you will pay those particular co-payments or co-insurance for your prescriptions in the initial coverage stage until you reach what's called the initial coverage limit. And for all drug plans this year, the initial coverage limit for Part D is $4,130. If the full cost of the medications, not what you pay for the drug plans, this year, initial coverage stage, exceed $4,130 in retail cost of drugs, Then you go into the next stage, also known as the coverage gap or the donut hole, which you may or may not have heard of. So typically this year, if you enter the coverage gap, also known as the donut hole, you will pay 25% of the cost of generic drugs or 25% of the cost of brand drugs until you reach the coverage gap limit, or true out of pocket what you pay of $6,550. So what contributes towards that $6,550 in the coverage gap and gets you into this next stage called the catastrophic stage? Let me go back 2 slides. So when you're in the initial coverage stage, the retail cost of the drugs contribute towards that $4,130 initial coverage limit. So once the full cost of the drugs, not what you pay, in the initial coverage stage, breach $4,130, then you go into what's also known as the coverage gap or donut hole. What gets you out of the coverage gap into the catastrophic coverage level is any deductibles you pay in stage 1, any co-payments or co-insurance that you pay in the initial coverage stage contribute towards the coverage gap limit of $6,550. And when in their coverage gap, the 25% of the cost of generic drugs contribute towards that $6,550. And the 25% of the cost of brand drugs you pay in the donut hole or coverage gap contribute towards that $6,550. And then fortunately, the manufacturers for most brand drugs in the coverage gap, the other 75% you're not paying, contribute towards that $6,550. So once the combination of what you pay in the various 3 stages and the manufacturer pays for brand drugs in the coverage gap exceeds $6,550, then this year you'll go into the catastrophic coverage stage. And if you're in the catastrophic coverage stage this year, you pay $370 for generics, $9.20 for brand drugs, or 5%, whichever is greater. And unfortunately, January 1st of the upcoming year, everything goes back to square one, and you're back at stage 1 for all the drug plans. They couldn't really come up with a more confusing model, but for all drug plans, whether it's a standalone drug plan that you buy that goes along with the Medicare supplement, or those that are integrated into the Advantage plans, have those 4 stages. There's no way around it. So those that are higher income Medicare beneficiaries that pay more if you're Part B of Medicare, they will also charge more if you're Part D of Medicare based on your higher income. They shake the trees any way they can. So they'll look again at your tax return as you modified your adjusted gross from 2 years previously, and those individuals that your modified adjusted gross was higher than $88,000 in the year 19, or those that have a joint tax return of greater than $176, you will pay for more of your Part B of Medicare and also your Part D of Medicare. It's an income-related monthly adjustment amount, or IRMA, which is the acronym. And the extra amount that they'll tack on is on your screen, and it can go as high as what you see on the bottom of your screen. And then they audit it every year, so your Medicare Part B and Part D premiums can go up or down based upon your filings. It's just, unfortunately, they will get you on both your Part B and your Part D for higher income, and then they will audit it every year. And if your if your income has gone down and they're basing it on 2 years previously, give Social Security a call and discuss your current financial status with them, and they may lower your Medicare premiums based on your current status. Otherwise, they'll audit it every year. So those that delay enrolling into Part D of Medicare and have a break in what they call continuous coverage for 63 days or more, and don't have what they call other credible coverage, basically other drug coverage, when you enroll in the future, they will incur a late enrollment penalty for your Part D for life. It's not a big penalty. It's more of a nuisance than anything. The penalty is 1% for every month you're eligible for Part D drug coverage and didn't have it, multiplied by the the words here, for the Part D drug coverage, the national average premium. Excuse me, I had trouble finding that. So the national average base premium for Part D of drug coverage is around $35 a month. So if you went 24 months without enrolling into Part D drug coverage, there'll occur a 24% penalty of around $35, which is around $8 and change per month, which will tack on per life of your Part D drug coverage. It's more of a nuisance than a penalty. And it's always a good idea to enroll into some type of Part D drug coverage so you have the coverage in case you need it and don't get penalized later for enrolling late. So Extra Help, this is a Medicare program that can help people with limited income and resources pay for Medicare drug costs. It's also called Low Income Subsidy. Low Income Subsidy, there's 4 different levels you can apply for. And not only can it help pay for your Medicare Part D drug costs, it can help pay for monthly plan premiums, deductibles, co-insurance, or co-payments. So if you think you're qualified for Extra Help, give Social Security a call and discuss your current financial status with you, and they may give you some assistance with your plan premiums, deductibles, co-payments, and co-insurance. So now we're going to discuss the various enrollment timeframes for enrolling into the Medicare Advantage plans or the Medicare supplements and the Part D drug plans. There is an initial election period, which is turning 65 new to Medicare. There is a special election period based on different scenarios, such as leaving employer-sponsored group health coverage, permanent moves, 12-month trial basis. The annual election enrollment period, which occurs every October 15th or December 7th. And that time frame applies to Part D drug plans or Advantage plans only, not the Medicare supplement plans. And there's a relatively newer one called a Medicare Advantage open enrollment period for existing Medicare Advantage members only. So if you're turning 65 and new to Medicare and would like to enroll into a Medicare supplement plan, if you're new to Part B of Medicare and want to enroll into a Medicare supplement, also known as Medigap, you have guaranteed issue where they do not ask any health questions for a period of 3 months before you turn 65, up to 6 months after your Part B Medicare goes into effect. So if you would like to enroll in a Medicare supplement and you're new to Part B of Medicare, you have 3 months before your effective date of Part B to enroll into a Medicare supplement, or 6 months after your Part B of Medicare goes into effect with no health questions. Those that are turning 65 and new to Medicare and would like to enroll into a Medicare Advantage HMO or Medicare Advantage PPO, you may enroll 3 months before your Medicare eligibility goes into effect, up to 3 months after you turn 65 and your Medicare A and B goes into effect with no health questions for a Medicare Advantage plan. And it's the same time frame for a Part D that you can enroll 3 months before, up to 3 months after your Medicare Part A and or Part B goes into effect, whichever happens first. And there's no health questions for the Medicare Advantage plans or the Part D drug coverage. So for the Medicare supplement plans, you must be enrolled in the Medicare Parts A and a Part B. You can apply 3 months before your Medicare eligibility goes into effect, up to 6 months after your Part B goes into effect. And with the Advantage plans, you have 3 months before your Medicare A and B goes into effect, up to 3 months after your Medicare A and B goes into effect for an Advantage plan. And for the Part D drug plans, you have 3 months after, up to 3 months after your Medicare Part A and or Part B goes into effect, whichever happens first. So those that are leaving employer-sponsored group health plans have a little bit slightly different eligibility for enrolling. Those that are leaving an employer-sponsored group health plan, you have a guaranteed issue where they do not ask any health questions for up to 63 days after your group health plan terminates, or up to 6 months after your group health plan terminates if you're new to Part B. and you must be enrolled in a Medicare Part A and or Part B. We've never had a gap in someone's coverage, but if for any reason you do miss the enrollment period after group insurance terminates, you have these windows to fall back on. So if you're leaving group health coverage and your Medicare A and B has been in effect for years, you have 63 days after your group coverage ends to enroll into a Medicare supplement. If your group coverage terminates and you're new to Part B of Medicare, then you have 6 months. So those that are leaving employer-sponsored group health coverage and want to enroll into a Medicare Advantage HMO or Medicare Advantage PPO, instead of 63 days, they made it 2 months or 60 days for whatever reason. So if you're leaving group health coverage and you have 60 days after your group health coverage ends to enroll into a Medicare Advantage with guaranteed issue, and you must be enrolled in the Medicare Parts A and B to enroll into a Medicare Advantage plan. If you would like to enroll into a Part D drug coverage, once your group health coverage terminates, you have 2 months to enroll in a Part D drug coverage, and you must be enrolled into Part A and or Part B of Medicare to enroll in a Part D drug plan. So there's quite a few different special enrollment or election periods to enroll into different type of Medicare plans. If you're new to Medicare, if you're new to Medicare A and B and enroll into an Advantage plan when you turn 65, you have a 12-month trial basis to enroll into a Medicare Advantage plan. You have 12 months to try out the Advantage plan. If for any reason you enroll into an Advantage plan and you're new to Medicare Part B and A and turning 65, if for any reason during the initial 12 months you're not happy with the Advantage plan or simply want to get a Medicare supplement for whatever reason, they'll give you a special enrollment period anytime during the initial 12 months to terminate the Advantage plan and enroll into a supplemental plan and a drug plan with no health questions. Those that have a Medicare supplement plan and would like to enroll into a Medicare Advantage plan for the first time, at that time, they will give you a 12-month trial basis to try the Advantage plan out. If for any reason during the initial 12 months of coming out of a Medicare supplement and trying an Advantage plan for the first time, they'll give you that 12-month trial basis. Unfortunately, they don't give you both 12-month trial bases. They give you one or the other, but it's nice that they do that. So if you're new to Medicare, turning 65 and enroll in an Advantage plan, or those that have a supplement and try an Advantage plan for the first time, they'll give you that 12-month trial basis to try the Advantage plan out. If you're not happy with the Advantage plan and want to get a Medicare supplement or simply get your Medicare supplement back, you can do so anytime the initial 12 months and get your Medicare supplement back with no health questions. So the annual election period, this occurs every October 15th through December 7th. This is the time frame that you can enroll, disenroll, or switch your Medicare Advantage plan or standalone Part D drug plan. This does not apply to the Medicare supplement plans. So between October 15th and December 7th, you can enroll, disenroll, or switch your Medicare Advantage plan and Part D prescription drug plan. For the Advantage plans, again, you must have Part A and Part B. And for the Part D drug plans, you must have Part A and or Part B. If you make a change during this time frame to your Advantage plan or drug plan, the plan will become effective January 1st of the following year. And we get real busy during this time frame reviewing our clients' Medicare Advantage plans the upcoming year, how they cover their prescriptions, and the Part D drug coverage. The Part D drug coverage, unfortunately, they change every single year. If you have a Medicare supplement plan or an Advantage plans, the prescription drug coverage can change every year. And whatever plan is cost effective one year may not be next year. And whether your medications change or not, we can't stress this enough, you should have us review your prescription coverage every time during this enrollment period between October 15th and December 7th, because it can be a vast difference between one year to the other. and one's medications may change. So it's a good idea to review your coverage every time during the annual election period to see how your Part D drug coverage is going to cover you the upcoming year. And there's another couple other enrollment periods that are not on your screen. If you have a Medicare supplement plan in force and your 6-month window terminates or your 63 days after having group coverage ends, you could actually change your Medicare supplement anytime during the year if you can answer health questions no. But if you have a Medicare supplement plan and then in the future company Z is a more attractive premium and you have health conditions that later on develop them, every year on your birthday, if you have a Medicare supplement plan in force, you have a period of 60 days after your birthday to where you can switch to a different company that has equal or lesser coverage, no health questions. So if you have a Medicare supplement and you have health conditions later on develop them, and another plan has equal or lesser coverage, every year on your birthday, you have a window of 60 days after your birthday to where you can switch to a different company that has equal or lesser coverage with no health questions. So it's nice that they have these enrollment scenarios that you can change your coverage. And this one is relatively new. It's called a Medicare Advantage Open Enrollment Period. And this applies to existing Medicare Advantage plan members only. That if you have a Medicare Advantage plan in force between January 1st and March 31st, you can actually change your Advantage plan once during this time frame. Not very many people are aware of this time frame because they can't advertise it or target anybody. So you could change your Advantage plan during the annual enrollment period between October 15th and December 7th. And let's say you didn't review your coverage during that time frame and you go to the pharmacy in January and your medication is not covered or is an exorbitant price. You can actually review your coverage during this time frame between January 1st and March 31st and change your Advantage plan once during this time frame. And if you change your Advantage plan during this time frame, the new plan becomes effective the following month. So if you have an Advantage plan, you can change it once during this time frame. Or those that have an Advantage plan and would like to enroll into a Medicare supplement plan, you can actually disenroll from the Medicare Advantage plan between January 1st and March 31st, apply for a Medicare supplement and a Part D drug plan. If you're going to use this time frame during the Medicare Advantage open enrollment period to enroll into a Medicare supplement plan, we would highly recommend enrolling into the Medicare supplement plan and make sure you get issued, because they can turn you down based on health if you're not in a guaranteed issue scenario. And we don't ever want to leave anybody out of coverage. So if you're using this time frame to apply for a Medicare supplement, again, we'd highly recommend applying for the Medicare supplement plan before enrolling into a Part D drug plan. If you enroll into a Part D drug plan during this time frame, it will automatically cancel your Advantage plan out the following month. So we always want to make sure you get issued by the Medicare supplement carrier first before applying for a Part D drug plan during this time frame. So again, we can't stress enough to apply for a Medicare supplement plan during this period between January 1st and March 31st. Make sure you get accepted, and then once you get accepted, apply for a drug plan, which will terminate your Advantage plan the following month. Or if you're simply switching your Medicare Advantage plan to a different company, you can do so during this time frame. The new Medicare Advantage plan becomes effective the following month. So I know we went over a lot of information. I'll be taking questions now. If you need further assistance, we have an office in Costa Mesa. We see everybody at appointment. We schedule a 2-hour block for our appointment because there's a lot of information to go over what Medicare entitles you to, the various Medicare supplements, their benefits, the different plans, their premiums, the Part D drug plans, the Medicare Advantage plans. We want to take a look at your physicians to see how they're covered. Please give us a call or an email if you have any other questions, and I will take some questions now. So the question is, how hard is it to appeal, or I don't make now what I made then? So I'm assuming this applies that for your Part B premiums and or Part D, if you have an income-related monthly adjustment amount or IRMA, Social Security will base your Medicare premiums on your income from 2 years previously. So if you're eligible for Medicare and they're basing your premiums on your employment from 2 years previously, and your income has gone dramatically down, or you have an anomaly, you cash an annuity or sell a property, but your income is still low, give Social Security a call and discuss your current financial status with them, and they more than will likely lower your Medicare premiums based on your current financial status. Otherwise, they'll audit it each year. So the next question, if I'm currently covered by my spouse's medical coverage, do I have to enroll into Medicare at age 65? So this is a very good question. So if your spouse is still working and you're covered under group insurance and you're eligible for Medicare, you can actually delay, and there's more than 20 employees, you can delay signing up for Medicare A and or Part B with no penalty. So if you're working and your spouse is covered under group insurance and there's more than 20 employees, or your spouse is working and you're covered under group insurance as a dependent, and there's more than 20 employees, you can go ahead and delay your Medicare A and or Part B with no penalty. If there's less than 20 employees, you're covered under group insurance, eligible for Medicare, and most of the time you're going to want to enroll into Medicare Parts A and or Part B, because if there's less than 20 employees eligible for Medicare, typically Medicare becomes primary at that point. There's exceptions to every rule, so always check with the benefits advisor, human resource, to see how Medicare coordinates with the group insurance. Okay. So this one is, I have a Cigna Medicare Supplement or Medigap plan, and I'm thinking of switching over to a Medicare Advantage PPO. Can I change coverage at any time or only during the Medicare enrollment period? So that's a good question. So those that have a Medicare Supplement plan and you would like to enroll into a Medicare Advantage plan, and you've been with the Advantage plan longer than a year, typically you're going to need to enroll to the Advantage plan during the annual enrollment period, which is every October 15th through December 7th. So you have a Medicare supplement, and if you're new to Medicare and enroll in an Advantage plan, you have 12 months to try the Advantage plan out. If you're not happy with the Advantage plan during this 12 months, you can enroll in a Medicare supplement and a drug plan, no health questions. Or if you have a Medicare supplement plan and you'd like to enroll into an Advantage plan and you've never been with an Advantage plan, you would need to enroll in the Advantage plan during the annual enrollment period, which again occurs every October 15th to December 7th. The Advantage plan will become effective January 1. And it will automatically cancel out your Part D drug plan, and you would have to cancel out your Medicare supplement plan January 1, because that will not automatically be canceled. And anybody comes out of a Medicare supplement and tries an Advantage plan for the first time, they will give you that 12-month trial basis. And if you're not happy with the Advantage plan, simply want to roll into a Medicare supplement for whatever reason, they'll give you that 12-month trial basis, try the Advantage plan out, and get your Medicare supplement. If you're interested in enrolling in a Medicare Advantage PPO, definitely compare that to the Medicare supplement plans. The Advantage plan premiums are pretty high, and the co-payments and out-of-pocket expenses that you have can be quite extensive. And typically the supplements are a little bit better coverage and a lot less out-of-pocket than a Medicare Advantage PPO. So always compare those two. We really haven't enrolled anybody into a Medicare Advantage PPO in quite some time because of the premiums that are involved and the out-of-pocket expenses versus a Medicare supplement plan. So always compare how the Advantage PPO plan compares to your Medicare supplement plan. You may be surprised. Okay. So this other question is, I'm interested in having a geriatric doctor. Does it matter which program I enroll with? So with the Medicare Supplement Medigap plans, you can go to any doctor, any facility throughout the United States taking Medicare patients. You don't have to have referrals or authorizations for procedures. With the Medicare Advantage HMOs, you do need to have a primary doctor in order to access the primary care physicians. And there are primary care physicians out there that have geriatrics as an interest. So if you have a Medicare Advantage plan, you can choose a internist that their area of interest is geriatrics, or they can refer you to a specialist that is a particular geriatric doctor. But either type of plan, a Medicare supplement, or a Medicare Advantage plans, you can access a physician that is with geriatrics. Just with the supplements, you can self-refer, and with the Advantage plans, if your primary doctor area interest is not geriatrics, then you would need a referral from your primary care physician to see the geriatric specialist. Okay, so if I'm working past age 65 and have coverage through work, am I correct that I need to apply for Medicare 3 months prior to retirement and must stop giving my to my HSA 6 months before retirement? So if you're still working, covered under group insurance, and there's more than 20 employees, you can actually, again, delay your Medicare A and or B until such time as necessary. I know those that have a health savings account contribution by employer and they're still working, eligible for Medicare. Typically, you don't want to contribute to your HSA within 6 months of enrolling into Medicare because it can have an effect on that. But if you're working covered group insurance and there's no HSA, you can go ahead and go ahead and enroll into Part A and delay your Part B if there's less than 20 employees because it won't have any bearing. But if you have an HSA, always check with your benefits advisor or human resource to see how enrolling into Medicare A and B will affect your HSA. Okay, so if you're taking no medications, this is a good question, we get this one often. If you're taking no medications, do you still need to enroll into some type of Part D drug plan to avoid penalties? Unfortunately, yes. So if you have a Medicare supplement plan and you're not taking any medications, we usually just recommend the lower cost premium plan so you have the coverage in case you need it and don't get penalized later for enrolling late, because whether you're taking medications or not, and do not enroll in a Part D drug plan and have no other credible coverage, they will penalize you later on for enrolling late. With the Advantage plans, most of the Advantage plans don't have a monthly premium, and the drug coverage is usually included. With the Medicare supplement plans, the standalone drug plans, there's 32 different drug plans you can choose from, and the least expensive drug plan this year is $7.20 a month, so it's very economical. And we still recommend enrolling into some type of drug coverage so you have the coverage in case you need it and don't get penalized later for enrolling late. But you don't have to enroll. There's just an incentive to do that. Okay. So if I go to Medicare and explain my income has gone down and they lower my Medicare premiums, will they credit my Medicare premiums back to when my income went down? This is a good question. So if you have an IRMA, income-related monthly adjustment amount, and they're charging more for your Medicare premiums, and your income is lower than the thresholds that they're charging you more for, give Social Security a call, not Medicare, and discuss your current financial status with you. Unfortunately, I do not think they'll credit you your premiums that you paid more for. That's a good question to give to Social Security, but my assumption is, unfortunately, they will not back pay your Medicare premiums that they charge you more based on your income. But that's a good question to give Social Security. My inclination is, unfortunately, they will not refund your money if you have a higher income-related monthly adjustment amount based on your income from 2 years previously. But always give Social Security a call and discuss your current financial status with you, and maybe they'll give your back premiums to you, but unfortunately, I highly doubt it. Okay, so is there a special form to fill out to not pay the Medicare premiums once someone retires? I don't believe there's any specific forms out there. If you enroll in the Medicare, eventually they'll send you some type of correspondence that you've been enrolled in the Medicare. and then they will send you your Medicare premiums. And usually they'll send you one statement that says you'll be paying the standard Medicare premium this year of $148.50, and then usually that day or a few days later you'll get an oh by the way letter that they're charging more for your Medicare based on your income. At that point, once you get the oh by the way letter that they've increased your premiums based on your income from 2 years previously, at that point you'll want to contact Social Security to discuss your current financial status with you, and they may lower your Medicare premiums based on that. But I do not believe there's any particular forms out there. It's just a conversation that you would have with Social Security to discuss your current financial status with them. Okay, so I understand it is more cost effective to sign up for original Medicare instead of the Medicare Advantage. Is that accurate? Well, I think there might be some confusion there. Your original Medicare has your Medicare Parts A and Part B, and your original Medicare has certain deductibles, co-payments, and co-insurance that it doesn't cover. And whether you enroll into a Medicare supplement plan with a standalone Part D drug plan, or if you enroll in a Medicare Advantage plan, you must be enrolled in Medicare Parts A and Part B and paying your Medicare premiums. So whether you enroll in a Medicare supplement with a standalone Part D drug plan or an Advantage plan, an HMO or Medicare Advantage PPO, you must have Medicare A and B and paying your Part B premiums. Again, with the Medicare supplement plans, you're going to be basically paying 3 premiums, 4 if you want dental coverage. With the Medicare supplement plans, you have your Medicare Part A you're enrolled with. You're enrolled with your Medicare Part B, paying your Part B premiums. You pay a premium for the Medicare supplement plan, and then you have a standalone Part D drug plan, which you're paying an additional premium for. And those that want dental, it'd be a 4th premium involved. The dental is not very popular with our clients that have Medicare supplement plans. I'd say less than 2% of our clients that have Medicare supplements have dental coverage. With the Advantage plans, most of them here in Orange County for the Advantage HMOs do not have a monthly premium. There's a few that have a slight premium for the Advantage plans, but you still have to have Medicare Part A and paying and enrolled in Part B premiums, and enrolled in Part B and paying your Part B premiums. It's just with the Advantage plans, the HMOs here in Orange County, most of them don't have an additional premium to what you pay for your Medicare Part B. But either plan, a supplement or an Advantage plan, you must have Part A and enrolled in Part B and paying your Part B premiums. We have a Medicare supplement comparison chart that I believe was emailed to you by your signing up for the Medicare Basics plan, and it's a great spreadsheet that you can look online or print it out. And that Medicare supplement comparison chart, it has, if you open it up or print it out and put it together, the inside pages to the left, it shows you what your Medicare A benefits are, their deductibles and co-payments, and also shows you what your Part B of Medicare covers you, and then has the various Medicare supplement plans for comparison. And on the back of the chart, it has a lot of the various enrollment timeframes that we went over. It's a very helpful chart to reference. So take a look at that, print it out, or we'd be glad to mail one out to you. If you come into my office, again, we'll go over things in great detail, or we can have a meeting through Zoom or on the telephone. And again, we usually book a 2-hour appointment because there's a lot of information to go over between what your original Medicare A and B is, the various Medicare supplements, their benefits, the premiums, the Part D drug plans, how they cover your particular prescriptions, and then the various Medicare Advantage plans, their benefits, what they cover. And we want to take a look at your particular physicians that you access, and then your different enrollment scenarios between the 2 options, between enrollment and then your future enrollment between the types of plans. Okay, so this question says, if I wait till I retire and then enroll in if I wait till I retire and then enroll into Social Security and Medicare, how long will it take to be covered? So if you're working covered under group insurance and you're eligible for Medicare and there's more than 20 employees, you can delay your Medicare A and B until such time that you retire. Either the group insurance terminates or the employment terminates, or if the group insurance benefits change or the premiums become too cost prohibitive, then you may want to look at individual insurance at that time. Medicare and Social Security can be taken at 2 different times. So those that are eligible for Medicare don't always enroll in Social Security at the same time. So there are 2 different types of plan choices: Social Security, income, and Medicare. Sometimes you enroll in both at the same time. Sometimes you separate the 2 and enroll at 2 different time frames. Typically, if you enroll into Medicare, usually within the system in about 2 weeks. So let's say you need an effective date of July 1 and you enroll in the beginning of June or the middle of June. Typically, you're going to get your Medicare claim number within about a week to 2 weeks. Sometimes it can take longer than that, but typically they're pretty quick on processing the applications. So usually you want to get about 2 to 4 week time frame, and they're pretty efficient in enrolling. And Social Security, as far as the income, I'm not exactly sure on that, on how long that will take to get your income Social Security once you apply. So that would be a good question for the Social Security office. And again, if you need to call Social Security for whatever reason, usually call the local Social Security office because it's a lot quicker to get through than the main 800 number. And they have local offices in, I think, in Fullerton, Fountain Valley, Mission Viejo. So usually give your local Social Security office, they're a lot quicker to get through. But Medicare, they're pretty efficient as far as your enrollment. And then those that have Part A and want to enroll into Part B of Medicare, it's about the same time frame. It's about 2 weeks. Once you fill out the one form and then you and your employer fill out those forms and submit those to Social Security, they usually get you in the system with about 2 weeks. And if for any reason, after about 2 weeks after submitting those 2 Part B forms, Social Security, they're not in the system, give your local Social Security office a call, and they can usually input it right then and there. They're pretty efficient. And again, they're one of the better government agencies to deal with. Well, there's a lot of good questions. One other question that we get a lot that we didn't entertain today is, should I enroll in a Medicare supplement or a Medicare Advantage plan? Which one is better for me? Those that are used to self-referring and want to retain that, or you may have a lot of doctors and specialists that don't belong to a medical group, or they may belong to a lot of different medical groups. It's kind of hard to navigate through an Advantage plan, and they kind of gravitate towards a Medicare supplement plan. The Advantage plans work just as well. They have excellent benefits. They're very cost effective. They're just a little more restrictive on how you can access the providers. You do need to go through your primary doctor to access the specialists. If you have ongoing medical care with the Advantage HMOs with a specialist, typically you don't have to keep going back to your primary care physician. They have what's called a standard referral. If it's a new condition, typically you need to go to your primary care physician to refer to the specialist. And they work just as well. They're just a little bit more restrictive, and they're extremely cost prohibitive. If you have any more questions, or I didn't answer your question in detail, you need some more information, you'd like to set up an appointment, please give us a call. And we have an office in Costa Mesa. Our number's up on the screen. We do have an email, and we have a family business, and we'd love to hear from you. And thank you, everybody, for attending, and we look to hear from you in the future. Thanks a lot, and have a great day. Thank you.